The patient came into me for anxiety and panic that she was experiencing recently. The patient had been treated for anxiety steadily and stably for the past 3 years. And due to significant life stressors and transitions she was going through, her anxiety had increased and her panic attacks had increased as well. And so I started seeing the patient. The patient was increased her dosage of medication from the primary care provider side. And I started working with the patient weekly. What the primary care provider and I noticed was that the patient, even though she was working with both of us, was not continuing to progress. And so we were able to communicate about what thoughts we had about that. And having been working recently with the women's clinic at Metro Health, we started really considering the patient's age and that she was exhibiting some perimenopause symptoms. And so because we are deeply embedded within the healthcare system, we were able to communicate with the women's clinic and refer that patient into the women's clinic to start to address some of those perimenopause concerns. We started to realize that some of the mood changes that are very common, the most common symptom of perimenopause, is something that this particular patient was experiencing, and we're able to get her into the women's clinic. That service is comprehensive. They have a nutrition component. She started working with nutrition, and that is a great example of an entire care team working with the patient, all in service of her, really looking at her through that whole person lens and really supporting her in all of the ways that she needed support.